When I went into psychiatry in 1950, fortunately not knowing anything, but one of the conditions was, as a part of my offer for the job, I would have to learn psychiatry, which is fair enough. 1950, we had no treatment for any of the major psychoses. The only treatment was to lock them up forever. We had no treatment.
We don't really understand at a deeper level that we are what we eat. And I usually say to people, you know, you look down at your dinner plate and what you see doesn't appear like the raw material for hair or skin or teeth or nails. But that's exactly what it is. We are just food recycling machines.
People don't take care of themselves for one reason or another, and they come to the doctor expecting to be kind of bailed out by taking a medicine, a chemical, in order to treat the disease.
I mean, if we look back at the last 30 years, Homo sapiens is in a really sorry state. There is no question that there has been an increase in mental health problems. And the World Health Organization say that mental health problems have become the major area of health concern.
Psychiatry is very much dominated by the pharmaceutical industry, especially at this time. In fact, almost all of medicine is dominated by pharmaceutical companies. There's virtually no emphasis on nutrition, on lifestyle, on any of those things. Everything is supposed to be solved by the use of psychotropic drugs.
In 1950, we used to lock them up forever. In 2007, we lock them up with their drugs forever. There's no difference. They said they may be worse off today because they're also being destroyed. Their body chemistry is being destroyed by the modern drugs, which didn't happen nearly so much with the old drugs.
I would say some of the worst things were sleepless nights. The visions of demons in my bedroom window when I tried to sleep. Just awful. Like nightmares at their worst, as I remember. The hopelessness. I remember going through libraries looking for answers to mental illness, schizophrenia, madness, insanity, manias of all kinds. There were no answers.
So I can sort of remember my first session with Dr. Hoffer. It was very straightforward. He said, "Oh, you have schizophrenia." And I went, "I do?" And I actually had a name for what I had. And he said, "Do you hear voices?" "Well, yes, I do." Nobody's ever asked me that before. I guess they were just such a part of me that I didn't realize that I had voices until Dr. Hoffer asked me that. You know, are people, talking about you? And well, yeah, I hear people talking about me all the time, and it makes me really nervous, and, it's hard to deal with.
In the past 60 years, psychiatry has made little progress in the treatment of mental illness. Some might say no progress at all. New pharmaceutical treatments are not very different from the chemical straitjackets of yesteryear. What other treatments are available? Not much, if you stick to the mainstream. Can there be a better way to help the mentally ill? This story is about a biochemical approach to schizophrenia, but it applies to every one of us. Can it be that our thoughts, moods, and behaviors depend upon what we've had to eat? Abram Hoffer was born a few miles south of Weyburn, Saskatchewan. His parents were Austrians of Jewish descent who had come to Canada with an agricultural vision. By the time young Abram came along, the Hoffer family farm was doing very well. Abram, however, preferred schoolwork to farm work. In school, Abram studied the pellagra epidemic. Pellagra killed 100,000 Americans before its cause was discovered. It was caused by a deficiency of niacin, also known as vitamin B3. The U.S. government mandated the enrichment of flour with iron and B vitamins, which ended the pellagra epidemic in 1938. That was the same year Abram Hoffer got his Bachelor of Science degree and turned 21. He earned his PhD in agricultural chemistry in 1944. He became a medical doctor in 1949. Abram Hoffer was made head of the psychiatric research branch for the province of Saskatchewan in 1950.
Psychiatry, by the way, is what you might call it was a dumping ground. Whenever a doctor ran across a patient who was either schizophrenic or depressed or bipolar or senile, they would then send him on to psychiatry, who would then put him into a mental hospital or to an institution. One of the main problems in mental hospital was that many of these patients were angry and excited and hostile. The poor people were terror-stricken, they were screaming, they were shouting. There was bedlam. Bedlam was a good term for any old mental hospital. There was really bedlam there. And the main thing was to give people barbiturates or sedatives to try and relax them a bit.
Antipsychotic or neuroleptic drugs were discovered in the 1950s. Chlorpromazine was the best known of these. These drugs spread like wildfire through the psychiatric community.
And these drugs settled them down very, very quickly. It's amazing. You could get a screaming, shouting, crying patient, and 3 days later, he's blah. Now, he wasn't any better, but he appeared to be better. He was socially a lot better. They couldn't think, they couldn't reason, they had no motivation, they were slobbering, sitting in front of their TV, they couldn't work. They were hopelessly ill people, and the only advantage was that they weren't running around on the streets crying. They were being locked up or kept at home, and no one knew about it. That was the situation of psychiatry. So we were put in charge of all the failures in medicine.
If psychiatrists have become a group that spend their time looking at symptoms, coming up with a label, and prescribing a drug. That's basically what they do at this point. It used to be, when I went through residency, there was a lot of emphasis on psychotherapy and trying to help people, psychoanalytically or psychotherapy. But the point is that psychiatrists really just don't even do that anymore. They basically are just basically pill pushers for the pharmaceutical industry. I mean, to me, it's almost like a brainwashing of the medical profession, that this is the only way to do things. The pharmaceutical companies support the medical schools to a great extent. They support the journals. The first 50 pages of any important medical journal is taken up by advertisements for various medications, various drugs.